Question: what's a typical response for a clinician who wants to know more about a colleague's skill level? It's not uncommon to hear a clinician use some version of the phrase, "I would trust them to care for my family member." This video was created to introduce you to what is a very useful way of thinking about both learning and teaching. It's demonstrating something called an Entrustable Professional Activity, or EPA. We will cover what an EPA is, why it's important, what's involved in using EPAs in resident education, and what trust has got to do with it. Consider this multiple choice question. What is an EPA? A unit of professional work. B, what's actually done during the clinician's day. C, something that can be assigned, measured, and observed. D, that same something that a supervisor could trust a learner to do independently or unsupervised. E, a way to teach and assess learners. F, all of the above. In fact, each of these describes an EPA. Let's review some of the concrete examples. These are some EPAs for anesthesiology. Completing a preoperative anesthetic consultation, using the anesthetic assessment to generate anesthetic considerations and the management plan for surgical patients, anticipating, preventing, and managing intraoperative events and physiologic changes during surgical procedures, managing patients with acute pain, assessing and providing labor analgesia for the healthy parturition. Each EPA is a unit of work that outlines something an anesthesiologist actually does. So you can imagine your resident being entrusted to function independently for each of those activities. And so, it's something on which a learner could both be observed and assessed. Why might an EPA be important in the context of teaching and learning? The answer I turn to are the two elements of performance. One, confirming progress and performance for the key tasks of our specialty, and two, feedback on performance. First, let's start with confirming progress and performance amongst residents. In CBD, we want to be sure that each resident can competently perform key tasks. By tracking them, our competency committee will have the information to confirm who's making progress as expected and to identify early on if someone needs more support in a given area. Residents are to successfully achieve the required EPAs by the end of each stage of training, and faculty are to ensure that the EPAs are assessed and completed. An EPA represents the integration of a large number of competencies into a manageable number of activities for learners. This also allows for supervising faculty to meaningfully assess learners during the training program. The second element of performance is feedback. For years, learners have been telling us that they want more meaningful and helpful feedback. Feedback is one of the most effective ways to support a resident's growth and development. The most specific and meaningful feedback is based on what's directly observed. This is about directly observing the specific EPA task and providing meaningful feedback on performance. So what's trust got to do with it? The more a supervisor directly observes a learner, the more likely and easier it is to confirm that he or she trusts the learner to perform and act independently or unsupervised. And so, to bring it back to where I began, not just for learners by the end of their training program, but as a general professional aid, shouldn't we all aspire to be a clinician our colleagues would trust to take care of their family members?